Hey guys! So I want to go over some basics with you about CHF, or congestive heart failure. So if you're from the Ben Clark EMT program, then you have your NSAID teach that goes when the left ventricle weakens and blood backs up into the atrium, then it drips into the lungs, causing the classic early sign of left-sided heart failure, which is shortness of breath due to pulmonary edema. And then you talk about the right side of the heart and how it backs up into the rest of the body, and you see your clubbing, you see your sacral edema, your ascites, pedal edema, etc. So I just want to go over some basics to help you guys actually understand that a little better. So first thing is you guys need to make sure you understand the pathway of blood flow through the heart. That's going to affect your understanding of this. I have a video on my channel. If you go down to my channel, you can see a video I did with just a heart model, and I kind of point out and show you the path of blood through the heart. Make sure you understand that and have that memorized. That will affect your understanding of this and other things as well. So heart failure, what is it? How does it happen? What are the effects? Basically, heart failure is when the heart is unable, for whatever reason, to pump blood powerfully enough or fast enough to the rest of the body. And so as a result, blood starts backing up into the pulmonary circulation, to the systemic circulation, and the ventricles can't eject or fill with blood properly. A number of things can lead to this. Any sort of like heart disease, or a disease of the blood vessels like coronary artery disease or cardiomyopathy, or certain dysrhythmias, an MI, or a long history of high blood pressure. It's one of the most common ones. And so that long history of high blood pressure can lead to the walls of the ventricles to start getting really big and hypertrophying. And that can lead to the heart, the ventricle, being unable to fill and pump blood properly. When you get left ventricular failure, blood normally goes from the lungs into the left atrium, into the left ventricle, into the body, right? So now blood is starting to back up. So instead of all of it going in that order, some of the blood is starting to back up from the left ventricle into the left atrium and dripping into the lungs. And that's where you start to get your pulmonary edema, or that's where you get your shortness of breath from the fluid building up in the lungs. The reason it's often called congestive heart failure is because you can kind of hear that congestion in the heart when there's fluid building up in the lungs. So with right ventricular failure, normally blood is going from the body, right atrium, right ventricle, lungs, right? Well, just like with the left side, if it starts to back up a little bit from the right ventricle, right atrium to the rest of the body, you're going to get a really high pressure in all of those blood vessels throughout the body. And when that pressure becomes great enough, it's basically going to force fluid through the capillaries, and you're going to get your third spacing, and that's where fluid is starting to build up into body, like into the fingers, into the the sacrum, into the feet. That's why a lot of CHFers, you see really swollen ankles and feet. If you're from Ben Clark, then you were probably taught that the cause of right side heart failure is always left side heart failure. It's not actually true. It is a cause a lot of times. However, there's also something called cor pulmonale, and this is basically where the right ventricle fails due to a lung-related issue, something like a pulmonary embolism or pulmonary hypertension. Pulmonary hypertension, by the way, is just a disorder where the pressure in the pulmonary arteries is higher than normal. You'll see this in a lot of COPDers. So the right ventricle has to pump really hard against this increased pressure in order to pump blood into the pulmonary circulation. And over time, you'll see the right ventricle start to enlarge and then eventually fail. So how does the heart compensate for this? Well, initially this all starts out as heart dysfunction. The heart can do a number of things to try to work around this. It can stimulate the sympathetic nervous system to increase the force or rate of contraction. It can stimulate something called the renin-angiotensin-aldosterone system, the RAS system, RAAS. You can look this up on YouTube if you're curious to learn more about it. But eventually this heart dysfunction is going to lead to heart failure. Signs and symptoms. So if you're from the Ben Clark EMT program, the main one you need to know for left-sided failure is shortness of breath due to pulmonary edema, also pink frothy sputum. Other signs and symptoms include increased respiratory rate, increased heart rate, labored breathing, so accessory muscle use and suprasternal retractions, crackles, so take a piece of hair, rub it between your fingers next to your ear, kind of sounds like that, fatigue, orthopnea, so positional shortness of breath, it's harder to breathe when you're lying straight down, so that's why you want to set them up. For right-sided failure, if you're from Ben Clark, the main one you need to know is edema. Also just JVD, ascites, dependent edema is one of the big ones. You'll see really swollen ankles and feet and legs. Fatigue, nausea, loss of appetite are some other ones, but those are the main ones. That's it for now. Thanks for watching. Don't forget to like and subscribe.